Right, so today we're here with Mel from Cryomed, and we're going to talk to Mel about the secret radiofrequency system, which is a fractional microneedle radiofrequency system which is designed specifically for skin lifting, tightening and rejuvenation. So Mel, can you give us an example of, for our readers, what does this device offer?
This device enables you to stimulate collagen. So what we're doing is really addressing wrinkles and acne, surgical scars, also creating tightening. So by heating the deep dermis of the skin, we actually stimulate the body's response to stimulate its own collagen.
Okay, and it's bipolar radiofrequency. Can you tell us what that actually is?
Yeah, bipolar radiofrequency is electrical energy that actually enters the skin and then returns out of the skin back to the machine. So it literally is a heating device once again.
Okay, so there's no need for the little patches or anything like that?
No,
okay.
It's very safe. RF technology has been used for hundreds of years in medicine.
Okay.
So very, very safe.
Okay, and Mel, what clinical indications does it actually treat? So skin lifting, skin tightening?
Yeah, so wrinkle reduction, stimulating of collagen for repairing of acne scars, surgical scars, skin tightening, and just general resurfacing and anti-aging.
Okay, and it can be used anywhere on the body?
Anywhere on the body, so really good for post-baby crepey tummies.
Okay.
Give that a nice tightening and lifting appearance, but also any scars, stretch marks. We also use it for hyperhidrosis, so sweating under the armpits.
Okay.
Very effective with that for long-term or permanent reduction in that.
Okay, and what does it feel like? Like, is it really painful? I know most people think, anything laser devices is painful, but...
Look, it's really quite tolerable, and it should be tolerable, and the clinicians are trained to enable it to be tolerable. So if the patient has a lower pain threshold, we can change the settings so it is a tolerable procedure. Topical anaesthetic is applied prior to the procedure for an hour, and then there is a cooler device that we use in addition if it's needed.
Okay.
So the patient controls that, and yeah, it should be a tolerable procedure.
Okay. And is there much downtime? Like, is it something that you're going to need to take a couple of days off work, or what are you going to look like? And
good question. There's no social downtime at all. So immediately after the treatment, you've got redness, a little bit of swelling, but that settles over the next, say, 3 hours.
Okay.
So the worst time is immediately post, and then it calms down. You might get a little bit of redness the next day, maybe a little bit of swelling. Skin will feel a little bit dry, but there's no social downtime. Most people resume work or normal activities. You can put makeup on straight away, you can put it on the next day.
so anywhere on the body wouldn't matter, but if it's on your face, you might need to wear a bit of makeup the next day to cover it up.
Some people
you might not.
Some people can't even tell they've had a treatment.
Wow. Okay.
Everybody responds differently,
Sure.
but the worst case scenario is there is no downtime.
Okay. All right. And when can you expect to see the results? Like, is it instant, or does it get better over time, or?
It definitely improves over time, and it will improve up to 12 months after one treatment. But you do see your initial response within about 4 weeks. I would say to a client 3 months is the sweet spot.
Okay.
But definitely within 4 weeks you see an improvement, and it continues to improve over time.
Okay. And do you need more than one treatment?
Depends on on clinical indication, what
Okay.
we're treating, but normally I would suggest 3 to 5 treatments,
Okay.
spaced every month.
Okay, so there's sort of the one treatment, if you need another one, it stacks on top of the one before and it goes on like that. Is there a maintenance program as well?
Once again, depends on the patient and what we're dealing with, but I would recommend on a general sense 3 to 5 treatments initially, then one every, say, 6 to 12 months.
Okay.
Definitely you want to retreat within the 12-month period to keep that collagen train happening.
Yeah. Okay, great. And just the last question, what's the cost per treatment? Like, I know it varies everywhere, but a rough estimated cost?
Most clinics are charging $650 a face. Next are around about $400, or if you get it together, it's a bit cheaper. But yeah, typically around $650 a face.
Okay.
Yeah.
Okay, great. I think I had one more question. And who do you think the treatment's best for? Like, is there anyone that shouldn't have it?
No, anyone.
Okay.
Anyone. It's a great anti-aging tool. So obviously the demographic who get a lot of benefit are, 40-year-olds onwards, but any demographic can have it. It's great preventative maintenance for the younger age groups. Just
You didn't say 4-year-olds.
40.
40-year-olds. I was like, okay.
Yeah. So even younger women
Sure.
in their 20s, 30s, it's a great way to just keep that body clicking in with more collagen.
Yeah, or men, I suppose.
Oh, man,
for that matter.
absolutely.
Yeah. Excellent. All right, so if you're feeling like you need a little bit of a zhuzh up, maybe the Secret RF is what you're looking for. So if you're looking for a practitioner that actually has this device, if you just click on the Find a Clinic tab at the bottom, or you can actually send us an email to info@plasticsurgeryhub.com.au. Thanks, Mel.
You're welcome.